Welcome to Synapse 101, a short dose of neurological teaching for your daily rounds. Today, we will discuss the basic neuroanatomy in brain CT scan. Before that, let us define some terminology for reference. When we say coronal view, it's just like looking on a front view. Axial view is cross-section, and sagittal view is equivalent to side view. In CT brain, the brain is the reference density. If the density is similar to that of the brain, we call that area isodense. The higher the density, the whiter it will appear in CT brain, and we call that area hyperdense. The best example is the skull. Blood will appear white in plain CT brain as well. Calcification is another example. The lower the density, the darker the appearance, so it is called hypodense. CSF and air are the classic example of hypodense areas. When we start interpreting the CT brain, we focus on the following. Number 1, we do check the symmetry and making sure what you see on the right is also what you see on the left, like a mirror image of each other. If there is asymmetry, one of which is abnormal. Number 2, look for midline shift that will suggest increase in intracranial pressure causing mass effect on the other side of the hemisphere. Number 3, cross-sectional neuroanatomy. Review the key anatomical landmark for each section. Check the brain tissues, the gray and white matter, and look for any abnormal intracerebral lesion penetrating or compressing the gray matter or white matter or both. Look at the CSF space. Look for hydrocephalus, dilated cisterns, or any abnormal exudates or blood at the CSF spaces. Do not forget to look at the skull and soft tissue structures and look for scalp swelling, fractures, and check on the sinuses and orbit. Number 4, one can manipulate the window and change to subdural window to look for blood collection adjacent to the skull. Lastly, check the bone window to check on the skull, orbit, and sinuses or look for intracranial air. This is the falx cerebri that separates left and right cerebral hemisphere. Tentorium cerebelli that separates supratentorial from infratentorial structures. Supratentorial structures include the two cerebral hemispheres and its subcortical structures. Infratentorial structures include cerebellum and brainstem. These are some prominent landmarks when we cut open the cerebral hemisphere in the midline. Corpus callosum, thalamus, midbrain, pons, medulla, and cerebellum. This is an image of the sagittal view of a CT brain. The tentorium cerebelli divides supratentorial from infratentorial region, as I've mentioned earlier. The brainstem is divided into 3 parts, starting from superior to inferior, midbrain, pons, and medulla respectively. The cerebellum is posterior or at the back of the brainstem. This is the corpus callosum that is the largest commissural fiber in the brain. Commissural fibers connect left and right hemispheres. This is the lateral ventricle filled with CSF. Inferior to that is thalamus. Above the corpus callosum, you may recognize 3 lobes. Anteriorly is frontal lobe, followed by parietal lobe, and then occipital lobe as you go posteriorly. Let us start with the axial view from the lower medulla. This is the medulla anteriorly and cerebellum posteriorly. The fourth ventricle is the ventricle of medulla and cerebellum. The tonsil of the cerebellum is situated in inferior medial surface of each cerebellar hemisphere. Tonsillar herniation is often called coning. If it herniates through the foramen magnum, it causes compression of the medulla, leading to respiratory arrest and may be typically rapidly fatal. Compression of the fourth ventricle may also result into obstructive hydrocephalus. This is an axial view at the level of upper medulla. You may see the nasal septum, the external auditory canal, petrous bone, and mastoid air cells. The medulla, fourth ventricle, and posteriorly your two cerebellar hemispheres. The peduncle connecting the medulla to the cerebellum is the inferior cerebellar peduncle. This is an axial view at the level of the pons. This is the left eye, the temporal lobe, the pons, the fourth ventricle, the cerebellar hemisphere, and the middle cerebellar peduncle connects the pons to the cerebellum. This is an axial view at the level of the midbrain. Cisterns are compartments within the subarachnoid space where the pia mater and arachnoid membrane are not in close approximation and that CSF forms pools or cisterns. The suprasellar cistern, also known as the chiasmatic cistern or pentagon of basal cisterns, is located above the sella turcica, under the hypothalamus, and between the uncus of the temporal lobes. The quadrigeminal cistern, also known as superior cistern or cistern of the great cerebral vein, is located between the colliculi, the splenium of the corpus callosum, and the superior surface of the cerebellum and extends from the third ventricle to the great cerebral vein. This is still at the level of the midbrain. One can appreciate the ventricle of the midbrain, which is called the cerebral aqueduct or aqueduct of Sylvius, or also called as iter. The anterior part of the midbrain is the cerebral peduncle, where important tracts pass through like your corticospinal tract. The space created by the Sylvian fissure is the Sylvian cistern, where middle cerebral artery creeps through. This is an axial view at the level of the basal ganglia. This is the genu of the corpus callosum and the splenium of the corpus callosum. Lateral ventricle, third ventricle. Lateral to the lateral ventricle is the caudate nucleus. Lateral to the third ventricle is the thalamus. The white matter lateral to the caudate and thalamus is the internal capsule, which has three parts: the anterior limb, genu, and posterior limb of the internal capsule. Lateral to the internal capsule is the lentiform nucleus, which is composed of the globus pallidus medially and putamen laterally. Lateral to the lentiform nucleus is the insula, which is a part of the autonomic nervous system. This is a coronal view demonstrating the subcortical structures. This is the falx cerebri that separates left and right cerebral hemisphere. This is at the level of the genu of the corpus callosum. Inferior to that is the lateral ventricle, where CSF flows through the third ventricle via the foramen of Monro. Lateral to the lateral ventricle is the caudate, and lateral to the third ventricle is the thalamus. Thalamus connects to the other thalamus via the interthalamic adhesion. Here is our internal capsule, anterior limb, genu, and the posterior limb. Globus pallidus, putamen, collectively called as lentiform nucleus. The insula, then the Sylvian fissure here, and inferior to the Sylvian fissure is the temporal lobe, in which the most middle part is called hippocampus. This is an example of CT brain images starting from the inferior to superior cuts.